The obesity epidemic is one of the major global public health challenges of the 21st century, with a threefold increase in the prevalence observed since the 1970s. In addition to being one of the leading causes of diabetic, cardiac, and cancer-related diseases in America, obesity is also a significant burden on the America's healthcare and economic systems. In 2012, obesity added an additional $190 billion to America's healthcare costs due to increased chronic diseases associated with the epidemic, as well as an increase in emergency room visits and requirement of more resource-intensive treatments for obese patients, to name but a few causes. Contrary to historical perceptions which attributed the rise of obesity to lack of exercise, genetic predisposition, poor parenting, and even a possible virus, more recent research looks at how the impact of life in post-industrial societies and a westernized diet, in which more palatable foods are high in fat and sugar but low in fiber, have affected obesity rates. Changes to the United States farm bills coincided with the change in the food environment in the 1970s, when industrialization and commercialization led to increased food production and increased availability of high-energy foods, sweetened foods with high fructose corn syrup, to increase palatability and affordability. Since then, the world has seen an increase in fast food and sweetened beverage consumption, larger portion sizes, and increased in expenditure on food that is away from home, with the resultant emergence of food deserts, which are areas which lack access to affordable, nutritious foods, and food swamps, areas that are inundated with high-energy snack foods and where healthy food options are scarce. Recent literature has identified increased rates of obesity in minority groups, with the female population, people of low socioeconomic status, and certain racial minorities being the most severely affected. Some mechanisms that explain the disparities in rates between majority and minority groups include health behaviors, psychosocial stress, and decreased sleep duration. In addition, studies have shown that a high density of neighborhood supermarkets, as opposed to limited service restaurants and convenience stores, and infrastructure that's conducive to active commuting and physical activity, is associated with lower BMIs, and these commodities are scarce in poorer communities. A unique contributor to the obesity epidemic is the addictive potential of sugar. Exposure to highly palatable sugary foods leads to increased neuron firing in the reward center of the brain, which eventually occurs even in the absence of hunger, which then results in maladaptive, addictive type eating in order to achieve a sense of reward or pleasure from food. Over time, chronic consumption of high sugar foods then leads to an overproduction of the hormone insulin by the pancreas in order to control blood sugar levels, which eventually leads to failure of the organ, resulting in type 2 diabetes. But even though this relationship has been recognized by the WHO, the food industry continues to promote high sugar and high fat foods and spends millions of dollars each year to ensure that solutions like sugar tax and warning labels do not materialize. Environmental and social factors are amongst the most common identifiable causes of the rapid rise in obesity rates. And if we don't focus on the development and management strategies to tackle the epidemic, with emphasis on community and society-based approaches, studies predict that 64% of the United States population will be overweight or obese by 2025, with 20.5 million Americans predicted to be severely obese. Overcoming the epidemic requires a multifaceted approach in which there should be a focus on individual factors, such as limiting sugar consumption and engaging in physical activity, as well as community and public health-based approaches, with the creation of increased access to fresh produce in communities that promote active lifestyles and where food corporations come on board to formulate healthier food options. After the evaluation of current research and predictions, we can see the importance of making conscious decisions about our health and lifestyle, and the value of supporting companies and organizations that work to meet social and ecological needs and goals, as opposed to mass production and maximizing profit. Some changes that we can make on an individual level include placing emphasis on preparing meals from whole, unprocessed foods in the home, remaining up to date with universal recommendations for healthy living, learning to manage portion size, and avoiding products containing high fructose corn syrup. Thank you.